All right, more now on President Trump, along with the nation's top health officials announcing they believe studies show a possible link between the risk of autism and the use of acetaminophen among pregnant women. For more, I want to bring in Food and Drug Administration Commissioner Dr. Martin Makary. Thank you for joining us again, Dr. Makary. Thanks. And we know that in the past, right, the FDA has stated there's no clear evidence that appropriate use of acetaminophen elevates the risk of neurological disorders. But as of today, has that changed?
Yeah, we have a study from Harvard University and Mount Sinai that looks at the entire body of evidence because evidence changes over time. And they saw 27 studies that show an association and 4 studies that did not. And the dean of the Harvard School of Public Health concluded that there was a causal association between acetaminophen use in pregnancy and autism.
An association, as you have put it as well. So how soon will conversations begin with physicians about how to properly use acetaminophen, and do you expect any pushback there?
Look, we want to emphasize that the decision is still between a patient and their doctor. And so we want doctors to have the information. The FDA has put out a memo to all U.S. doctors letting them know about the updated information. But really the decision is going to be between a patient and their doctor.
The focus of today was the concern of increasing neurological disorders among American children, but the president seemingly giving medical advice on many things, including vaccines. Do you feel like today's announcement was handled responsibly by the president?
Well, look, the questions about vaccines that the president and the secretary have are questions the American people have. I think the biggest story today was that the FDA is taking action to make leucovorin available to kids with cerebral folate deficiency. That may be 20 to 50% of kids with severe autism, and they have a clinical improvement in studies. So I think it's an exciting day for the community of parents taking care of kids with autism, and we're going to keep going, exploring other potential causes involving the microbiome, involving new pathways, involving an autoimmune reaction to that folate receptor in the brain. I think this is going to be a national priority, and you're going to see more coming out.
RFK Jr. certainly made it clear that getting to the root cause of autism is a priority of his. In terms of leucocorvin and, frankly, the use of Tylenol as well, there was a lot of talk about label changes. How quickly does something like that happen?
I think the leucovorin label change will take place in about 2 to 3 weeks. We've started the process through the federal registrar today. The acetaminophen Dear Doctor letter went out today to U.S. doctors. And we'll do a formal process at the FDA to see if we should add the new concern about use in pregnancy and autism to the label.
The term low-dose, short-duration use of acetaminophen among pregnant women, it's my understanding that that is already the recommendation of how to use it, but also I'm curious if that's how you see it, and what designates a high fever. When should a pregnant woman consider taking acetaminophen?
Well, look, let's be clear. The vast majority of fevers are low-grade fevers, and they're short duration. And it's been a reflex in the medical culture that every fever gets treated with acetaminophen. I got calls as a doctor in the hospital that your patient had a low-grade fever, and we already went ahead and treated that patient with acetaminophen. And the bigger question is why? Are there times we can minimize the use or limit the use when there's a rapid rate in the temperature, because it's the rate of increase of a temperature where there's that concern in a young child having a fever and a febrile seizure as a result? Are there other times when we can consider other ways to try to lower somebody's body temperature? The government is not your doctor, and we're not telling people exactly what they must do or not do, but we're letting people know about an expanding body of scientific evidence that is pointing directly to this concern about acetaminophen in pregnancy.
The president said, though, if you can't tough it out, and it was talking about a pregnant woman. The concern, though, with a fever in a pregnant woman is not necessarily for the mother, but it's to the fetus. So what's your response to that? Can you defend what he was saying there?
Well, look, the studies that have said when a woman has a very high-grade fever that could have an adverse outcome on the baby, it may be due to the underlying reason for the fever, that is the infection, and not the fever itself. Again, we're letting those decisions take place between an OB doctor and a pregnant woman or a family doctor or whatever clinician or midwife is working with an individual. What we do know for a fact right now, Kana, is that acetaminophen has been given willy-nilly way too frequently without any discussion of the potential risks to balance out those discussions about the potential benefit. And we're just saying we want this body of scientific evidence now to be a part of that informed consent so that individuals can engage in proper shared decision making.
Dr. McCary, thank you for being here with us again. And I point out here, I know that this is something you're navigating yourself here as well as a father with a little one at home. So thank you for being here with us.
Thanks so much.